An infectious disease specialist, Dr. Todd Ellerin, joins me now for more. Good morning, Dr. Ellerin. You know, this morning on GMA, we heard Dr. Fauci say a vaccine could be available to some healthcare workers as soon as December, but it could be several months longer until it's widely available. Can you walk us through where we are in the vaccine process and what has to happen before it's available to the general public?
Good morning, Diane. This is so exciting, this news on the effectiveness of the Pfizer vaccine. This has exceeded all of our expectations. To think that you could achieve potentially 90% effectiveness, that's really astonishing. Now, with that said, there are still steps that the company has to go through in order to get that vaccine into our arms. The next one is that it has to prove safety, and it's going to have at least 2 months of safety and probably more than that for at least half of the 40,000+ volunteers that were in the study. So that's good news. Now, so far we know that there have been no pauses in safety, so we have every reason to think that this is a very safe vaccine. The next step is that the FDA has to look at this. They are going to be rigorous with looking to see that the efficacy and the safety warrants their giving Pfizer an emergency use authorization, where then and now this is the tricky part. The next part is they will have to distribute and administer. So first, Pfizer has built a bridge on efficacy and safety. The next bridge is distribution and administration. That's a Herculean challenge because you've heard that this vaccine has to be stored at close to minus 100 degrees Fahrenheit for periods of time before it gets into our arms. So, you know, and then I think one of the most important bridges is that for this to succeed, an effective and safe vaccine doesn't do the job. It's vaccination. These vaccines have to go into our arms, so we need the public's trust. And in order to achieve public trust, we have to educate them, we have to be transparent with our data and efficacy, and we have to listen to them and listen to what their concerns are. All of those things are very important because if we only have 50% of the population becoming vaccinated, that's not our goal.
I put a possibility out on Twitter to some followers to hit me with questions on COVID if they wanted. And a lot of them were asking about mutations. When they hear all this talk about the vaccine, and there seems to be a lot of concern about the possibility, what if the virus mutates and kind of gets used to the vaccine? Can you address that?
So this is definitely an important question. And remember, all viruses evolve, and this is an RNA virus, the SARS-CoV-2, the cause of COVID-19. But the good news is that it mutates far less than influenza does. So we haven't seen that mutational rate that we see with other RNA viruses like influenza and HIV. So that's good news. But this virus does evolve, and it's very possible that down the road we might actually need a booster for this vaccine, but that remains to be seen. The next step after safety and effectiveness, and we get it into our arms, and we see, you know, how long the durability of this vaccine lasts. That's very important. Like the flu shot, we know it's an annual shot. We need to get it the next year because there is that mutation. So we don't have that data yet, but hopefully, you know, sooner than later, we'll be able to answer some of these very important questions.
And then in the meantime, we know that prevention is the best way to address this. But what improvements have we seen in treatments for the virus?
Right. I'm glad you underscored the importance of prevention. And even when we're vaccinated, we're still going to have to use those prevention measures like masking and physical distancing for a while. As far as treatments, we really are heading in the right direction. In the spring, we just met this virus. Now we have antivirals like remdesivir, which can bring down the amount of virus in our body. We have dexamethasone, which is a steroid, which has shown decreased mortality in our sickest patients, those intensive care unit patients, one I just left the room of, and these patients are critically ill and they need every therapeutic possible for them to, you know, survive this, but they are surviving now. Or in the past, you know, death was something that we saw frequently. Now, while it's still something we see, it's much less frequently. And then now, just recently, we heard that Eli Lilly's monoclonal antibody got an FDA emergency use authorization. That may be best in the population of high-risk outpatients before they get into the hospital. So we haven't talked a lot about what do we do for the run-of-the-mill person that's high risk, has mild symptoms, and doesn't need hospitalization. Hopefully, this monoclonal antibody is a step in the right direction.
And some experts are proposing a 4 to 6 week lockdown to stop this new wave. Do you think that's necessary?
Oh, this is such a tough one. I'm going to tell you that I think the trajectory is that we're heading in the wrong direction fast. I do believe that parts of the country are going to have to lock down in order to get this virus under control. Having hundreds of thousands of cases per day. On one day recently, we had over 1,500 deaths in a day. You can imagine, Diane, that very soon we're going to have 200,000 cases a day and probably close to 2,000 deaths a day. So I do believe that there are going to have to be shutdowns. I'm hoping that there won't have to be a national shutdown. I think the states have to really be stringent right now. Let's put it this way. If you're in a state right now that you need mobile morgues to come because of the hospital, the capacity has been exceeded and you have too many deaths, we have to shut down way before that happens.
All right, Dr. Todd Ellerin, we appreciate your time as always. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.